So this is going to be two main parts. The first part is evaluating whether or not you actually have these traits. And the second part is, if you do have these traits, what you can do about it. So when we look at the aspect of, do you actually have these traits? The reason I ask that is not to doubt you, but to say that I have seen so many people who are neurodivergent and especially autistic who have been demonized and abused and gaslit their whole life to the point where they are so hypercritical that they very often see the disproportionate aspects of what they do as negative, whereas they don't see that necessarily the same way in other people. Also, there's the aspect of autism in and of itself causes a lot of rigid thinking and rigid senses of right and wrong, which can lead us to believe that even natural and healthy behaviors are manipulative, like standard relational behaviors we may view as manipulative, and that is not how other people are experiencing it. Right? Because having a certain level of self-interest is completely healthy and natural, but in order to get your way, you are trying to convince somebody which you may view as an autistic person as manipulation. And so there may be times where you're viewing getting your needs met as manipulation. And so we have to kind of first evaluate whether or not this is actually some overblown dark triad traits that you're expressing or experiencing, or if you are noticing those disproportionately, right? Everybody has some aspects of wanting to get their way, of lashing out when they shouldn't, of having these thoughts of, negative thoughts towards other people, or impulses or ideas of behavior that might be antisocial, or of being narcissistic in some way that they are, protecting themselves with some level of like, but I am the chosen one kind of mentality. And so everybody has some level of this. And yet most people who are not to the level of something like narcissistic personality disorder, who are deeply afraid that they may be narcissistic, or are deeply afraid that they might be Machiavellian, or are deeply afraid that they're antisocial, usually are not as antisocial or Machiavellian or narcissistic as they think they are, because it's a perspective issue rather than a reality of their behavior and how other people are experiencing it. So typically what I suggest in that case is to look at yourself and find other people in your life you can check in with, whether that be a professional like a coach, a counselor, a therapist, where you can talk to them and kind of get an idea of like, I'm doing this in this situation and I feel like I'm being really manipulative. And they can go, okay, that seems like this is an accurate assessment, or perhaps you were looking to get your needs met. And if that is that a healthy way to do that for you? Maybe there's some things we can tweak and make it feel better for you. Or maybe this is a natural, healthy behavior, but you've been traumatized and therefore it feels really squick at the moment because you're like so traumatized that you don't know how to express yourself or get your way or convince other people to do things without feeling like you are the manipulator or bad person. And that happens a lot of times with people who are autistic because of the way in which we have a disproportionate amount of trauma. Now, let's say, because these things can happen comorbidly, let's say you do have high dark triad traits and you're autistic. So you have noticed and you have accurately assessed the fact that you have dark triad traits. You notice that whether it's because of trauma, whether it's because you're feeling insecure, whether it's because you want to feel control over your environment and that helps you feel safe, that you are doing things that are perhaps antisocial or Machiavellian or manipulative, and you're noticing it enough, but it bothers you. Let's say it bothers you and you want to change that fact. You don't actually want to engage in that. The fact that you can notice it and not want to do it is a good factor. A lot of people who are very far along that to be the point of diagnosis, typically they're not as self-aware or they have no moral qualms in engaging in toxic behaviors. And self-aware and knowledgeably toxic with pattern recognition can be a very, very dangerous combination. But presuming, since you're asking this kind of question, you don't necessarily want to be that kind of person, which means that you are looking at your own behaviors and maybe your antisocial traits, or maybe even something like borderline personality, where the emotional fluxes within the autism are manifesting as like a very volatile kind of mood baseline. And those are causing a lot of extreme behaviors and like the valuation, devaluation aspects. Anything along those lines, regardless of the reason why, what your job is essentially in this is to look at and say, okay, when is this behavior happening? Is there something that causes this? Is there a feeling I have before this happens? Does this play into some kind of meltdown or shut down or overwhelm that I experience as an autistic person. Like, am I noticing that I'm being a raging asshole every time I've gone to Walmart because I'm overstimulated and I don't recognize it till I'm absolutely screaming at somebody? Probably should then regulate and figure out that I need to do something else, either other than go to Walmart, or find a way that I can, make space around that so I have decompression time so I'm not engaging in that behavior, right? So it's kind of patterning out yourself. You are reverse engineering you, and you are looking to figure out the ways in which you can either accommodate that particular issue, or that you can figure out ways to work with a professional, a psychologist, a therapist, a counselor, a coach, anything like that, or, work on yourself to say, hey, okay, this happens because I am insecure about being able to maintain value to someone else, or this is related to trauma, or this is insecurity, or this is, some other aspect. And you can identify and begin to work on that particular issue, on figuring out ways to increase your tolerance for negative emotions, or increase your ability to tolerate risk, or work on aspects of expanding your world a little bit in a way where this is less of a trigger for you. And so it's more individualized there once you've identified kind of what is causing, what situations or emotions or factors are causing you to have these reactions, what exactly you can do to change that behavior. Is it a new set of boundaries for yourself? Like, okay, I know, for example, I am not going to go to the grocery store on the weekend. I just don't go to the grocery store on the weekend. For me, unless it's an emergency, I don't go to the grocery store on the weekend because it is going to set me off. Either my PTSD, my autism, or my physical disabilities of having to deal with navigating so many people. I'm going to be overloaded. Something's going to happen. It's going to go wrong. So for me, I know that I can accommodate that by changing my behavior so that I don't become annoyed, aggressive, and bitchy at the people around me. So when we talk about this, a lot of this is really identifying your own behavior and kind of reverse engineering what kind of situations you can adapt for, and what things may need to be processed with a professional or therapist to be able to increase tolerance, increase frustration, and be able to feel safety without having to control the other people around you in order to get that.